Hi, Robert LeBlanc with Las Vegas News Blog. We're at Physical Institute. Hi, what's your name?
Hey, I'm Brian Warner, and I'm a physical therapist here at Physical Therapy and Balance Centers.
And tell me a little bit about what you folks do here.
What we do is we are a very specialized physical therapy and audiology clinic that works exclusively with patients with simple to complex inner ear and balance problems.
Okay, and then today, like Vicky, I know Vicky, she came in about 3 months ago initially because she bumped her head and had a severe concussion and had vertigo. So what has been going on with that process?
Well, with post-concussion injuries, we're starting to find that it's not just a cognitive problem. We're actually finding more and more that patients have what we call a vestibular or inner ear concussion. So the actual inner ear after the concussive event gets damaged. And they can develop a really strange disorder where pieces of the actual sensor that controls balance breaks off and gets loose in the inner ear, and it causes positional vertigo. And so we use this special chair, the Epley OmniX chair, which is exclusive to Physical Therapy and Balance Centers, to help reposition the debris back into a very small sac in the inner ear, and that sac then absorbs the crystals and these pieces of debris and fixes the patient.
Also, you know what? But what are a couple signs if people don't know what vertigo is? What actually will people feel when this is happening?
Right. You know, that's a good question because many people get confused with dizziness and vertigo, imbalance. Vertigo is very specific. So vertigo is an illusion of spinning. So if you lie down on your back or you look up and you feel an actual turning sensation in your body, or even if you see eye motion, you can actually see things moving, that's your classic vertigo. And that's what Vicky was expressing. And again, after these concussed inner ears, the patients will develop this very unique vertigo. It's called benign, a strange name, paroxysmal, comes and goes, positional vertigo, or BPPV.
And so today, in this Epley machine, tell me a little bit more about that. The idea here is to move it quickly. Like you said, this is kind of like a last resort.
Right. So this chair was originally designed by John Epley, the man who invented the maneuver to treat this benign positional vertigo, or BPPV. And the idea is that you have to use gravity to move the debris in a certain direction in the inner ear back into the sac that's inside the inner ear, and then that motion, or that movement, has to be quick, allows the debris to escape the canal and get back into that sensor or that sac, and fixes the problem. It's quite interesting.
So once it's fixed, is it fixed, or is there a chance it might come back, or how does that work?
Yeah, the thing with post-concussion inner ear disorders, it's kind of like it's like a cracked egg. Unfortunately, when you crack an eggshell, let's say a hard-boiled egg, the outer shell has multiple cracks and fissures on it. And unfortunately, with these patients, they'll develop this disorder. They could develop intermittently, unfortunately, through the remainder of their lives. It just depends on how severe it is. But it is something that often will require them to come back and get treated. But the nice part about it is we have this chair, and 1 or 2 visits, the patient can be cured.
Awesome. And what is your phone number? If
phone
people want to get a hold of you, how can they reach you?
A good number, easy. We all know 702. It's 702-818-5000. So 702-818-5000 is our number. And
what's your location?
We have 2 locations. We have a location in Henderson, Pecos, and 215, and then we have another location on Cheyenne and Buffalo in Summerlin.
All right. Thanks, Brian. Thanks for your time. Thanks for helping my honey here.
No problem. Thanks for coming. Bye.